Welcome back to another episode of Mind Your Rehab. I am Dr. Allison, and this is
Dr. Vinny.
Hello again.
Hi.
What's new?
I just got back from Canada.
Yep.
I had a very Canadian time. Let's see. I ate a good amount of poutine.
Yeah.
There was a lot of hockey going on in Canada because the Stanley Cup finals are still going, or Stanley Cup playoffs are still going on. The PWHL playoffs are going on, and the World Championship of Hockey was also going on. So when I wasn't at a bar or seeing a band play, I was watching hockey.
Yeah.
It was pretty cool.
Yeah. And for the record, he doesn't just bar hop. He was at a punk festival.
Yeah, I was at Pooza Fest, and it was great. It was a lot of fun. I'm sad that it's over, but I'm glad to be back at the same time.
He's tired. I'm tired.
Yeah, very tired.
Yeah. I didn't go anywhere, but I'm just tired.
You're allowed to be.
Yeah. So yeah, I update on me. I ordered my competition suit.
Woo!
I ordered my heels.
Woo!
And I joined the OCB organization.
Wow.
Which I forget what, I think it's called, OCB stands for like organization something bodybuilding. It's like a really weird.
I have no idea.
I don't know. It's not great. The full name of it, I think is, it's like a weird, it doesn't make sense with the words put together. But yeah, I think I'm a little over 11 weeks out. And calories they were cut, 100 calories were cut between last week and this week. So that was sad.
That doesn't sound that bad in theory.
I know, but it's like really obvious when I'm hungry.
That makes sense.
So I'm still working out just as hard, and I'm PRing actually.
That's
On
awesome.
my cut, so that's nice.
Such a badass.
Just more tired, and that's fine. That's worth it.
Yep. It's part of it.
Had another ankle flare up, so that's great. Or a continued ankle flare up. Yeah, I think last week we talked about it.
We did talk about it last week, yeah.
So just been managing that, but it's getting better. And yeah, I think that's really it. We got Frankie on the couch with us. I can show it in or you could just, if you're on YouTube, you can see his butt.
There you go.
That's pretty much it. And Baloo's laying down by her feet. So we got everybody here.
It's very hot in New Jersey right now.
It's terrible.
We're both wearing tank tops.
We live in a swamp because that's New Jersey. And so the humidity is extra.
New Jersey isn't just the whole state a swamp,
Right.
but we do live in the swamplands of New Jersey.
It's not like we live in a disgusting place. It's just literally swampland. So it's extra humid and it's pretty gross, especially for May. It's 90-something degrees. And while Vinny was away, we have a tatami mat that we use as our guest bed. And then we also like lounge on it with our dogs occasionally. And so we didn't put the AC, we have window units for our AC. And because our house is over 100 years old and we just, And so we didn't have the AC unit put into our bedroom before Vinny left. We just did it downstairs. So I just slept on the floor with the dogs while he was gone for one night when it was like 90-something degrees.
Yeah, that sounds miserable.
It's okay. It wasn't the worst ever. Plus I got to sleep with the doggies and they were way better.
Oh, that's good.
I tried sleeping with them. Yeah. If you have dogs that you sleep with, I don't know how you sleep.
Yeah, I can never sleep when they're in the bed with us.
Yeah, it's really rough. They're pretty inconsiderate. Frankie's pretty good. Baloo is pretty inconsiderate. He just gets up constantly, tries to move around. He starts digging at the bed, licking. Oh, God, it's gross. Anyway, so today's topic is about passive care versus active care. So what does that mean? Let's actually give an example today of you spoke to somebody on the phone.
Yeah, I was speaking to somebody on the phone. They reached out to us because they're dealing with low back and hip stuff. And when I asked him what he's been doing or what he's been trying to do to help address the issue, he said that he's a very active person in the gym, but recently he's decided to stop lifting weights because he doesn't know what's going on. He doesn't know how to solve the problem. So he just thought, okay, well, potentially lifting weights got me in this position, so I'm going to stop lifting weights. And he's just been trying to do stretching instead.
Yes.
Was I telling the story way too long?
No, you were just telling the wrong one. This was going to be the topic next week. But it still ties in. There was another conversation you had, the dry needling.
Oh, yeah. I've had a lot of conversations on the phone since I've been there.
Yeah, that's okay. Well, I mean, the stretching is still part of passive care. So let's talk about the dry needling though. You said somebody called in about that?
Yeah. So somebody else, this one was a woman, so it'll be easy to remember that the man was taking a break from lifting and the woman was the one who had the dry needling wants, I guess.
Categorizing them.
Yeah. It works in my brain that way.
Yeah.
So yeah, the woman had an active issue in her ankle and lower leg. She said she was weekend warrioring, which I thought was a great way to put it. And yeah, she's gone to PT. She's gone to in-network PT. She had some success there, and they were doing dry needling amongst other things with her. And she was asking about the dry needling because she thought that she was getting some benefits from the dry needling.
Yeah, and I'm sure she was. I'm actually impressed that there was an in-network facility that did dry needling, to be honest.
Yeah.
I don't know. Maybe that's more common now in network settings.
Maybe. I know a lot of people know at least dry needling. Like, actually, this is kind of funny because I said to her, I was like, oh, yeah, Dr. Allison is an acupuncturist, so you'll definitely be getting some, something like that when you're here. And she was like, well, what about dry needling, though?
Yeah. I mean, there are two different things. This is probably not that interesting to the audience, but
maybe it is though.
Yeah, maybe it is. So I'll talk about it. So dry needling, for anyone who doesn't know what dry needling is, it actually is a bastardized version of acupuncture, because traditionally, dry needling was done with a hypodermic needle, not an acupuncture needle. A hypodermic needle is one that you get your blood drawn with.
Woof.
Yeah, and so you get lidocaine injected into trigger points. That was the traditional way of doing dry needling. And then somewhere down the line, I don't really remember what happened, but PTs have pretty good legislation. Acupuncturists don't. And so PTs legislated for themselves to get dry needling as a form of therapy. And they use acupuncture needles, and they put the needle into an area, and then they kind of drill it in and out of that area a whole bunch, and it elicits muscle twitching. And I use this as an acupuncturist. My background, what are you smiling?
But the idea, you said drilling into the tissue. That does sound pretty miserable.
I mean, I'm going to be honest. It doesn't feel good, but it is helpful.
True.
So as an acupuncturist, I use dry needling. And for a long time, when I was a student in school, they made us hate the term dry needling, because it was like, how dare they take acupuncture needles and not call it, I don't know. It's like an ego thing. I don't really give a shit. I do dry needling. It's fine. So yes, I do dry needling. It's just like, I didn't go to a fucking weekend course to do it. Instead, I took 3 years of acupuncture, and I know how to manipulate the needle. and
very different
needle for dry needling. Yeah, but the reason why I thought this was an important topic is because there are plenty of times where people go to a therapist, whether it's chiropractic or PT or massage, and they just get what's called passive care. So passive care means you yourself are not doing anything. Things are being done to you. So soft tissue work is passive. Chiropractic adjustments are passive, joint manipulation, acupuncture, cupping, Graston, all these things are passive. And by no means are they bad. They're just not, there's going to be a limit as to how much they can help you. So it is, just as like a I don't even know if this is considered a philosophy, but I think it's pretty scientific that joints act and muscles react. So the joints tell the tissues what to do, not the other way around. Stretching is also a passive thing unless you're doing what's called active stretching. So passive care is not going to retrain your joints how to do anything. Because again, if you're passive, that means nothing's actually, it's just being done to you.
Yeah, yeah.
So if your joints aren't learning how to change the way they move and you're just working on the muscle tissue, then things are just going to persist the way that they always have, because again, the joints tell the tissues what to do, not the other way around.
That makes sense. I think you said you're not training the joint specifically, and that's something that's really important to pay attention to.
Yeah.
I remember when I was growing up, I was a competitive gymnast, and like we used to just spend minutes upon minutes of stretching at the end of our practices, and even like coaches would be like pushing you further into the stretch, or you'd like put your leg up on mats or something like that. Like I've definitely had my adductors torn because some jerk coach was trying to push me down way further than my joints had the capacity to go at that time.
I'm sorry. I have to sneeze. Oh no. Ooh. Made the computer freeze.
Yeah, maybe we'll take the sneeze out of the recording.
Yes, that's pretty loud. If you hear any licking, it's Baloo. It's not me. So he's licking near the microphone. So, yeah, I mean, to that point, it's like if your tissues aren't ready to go into a range of motion, forcing them there is not going to, that's definitely not the answer. Opening up joint range of motion will allow the tissues to understand how to lengthen and stretch and contract in that lengthened position and things like that. So there really needs to be an emphasis on joint training and muscle training. Like you do have to train both tissues. And yes, bone is a tissue. Joints have tissues. Bones are tissues. Everything's tissue. So I'm going to say, but typically when I say tissue, I'm talking about like soft tissues. So the dry needling, the way that I use my passive care is to essentially create more passive range of motion in order to get more active range of motion. And the reason why I do that is because our passive range will always be greater than our active range. So if somebody, let's say you're lying on your back and somebody picks up your leg and brings it into an overhead type of position, they are likely going to get it much further than you could on your own, unless you are a dancer or even a gymnast and you have that ability to move through that.
Or anybody who has just trained that range.
Exactly, yeah. Same thing with you being in a seated position, like an L-sit, and you bending over your hips to touch your toes. That's a passive stretch through your hamstrings. Your hamstrings aren't doing the work to get you there. So, and they're not really engaged. Your quad's not engaged, nothing's engaged. But your passive range is always going to be greater than your active range. So I like to help open it up with passive work to bring blood flow into the area, to help reduce pain. And then, because those short-term things can help guide the way for more pain-free range of motion. So I like to use that as a prerequisite going into the rehab in the same appointment. But there's very frequently people who, reach out to us or work with us who their experiences in rehab are all passive and very little active. And they don't hit their goals, and it's because nothing's actually changed. They just get short-term relief. And there is benefit to that short-term relief, but it's not the thing that will get you to where you want to go.
Yeah, it'll only take you so far. It could be a step on the path to getting you to where you want to go.
Right. The other thing is like, I remember I've been practicing for over 12 years. I remember like in maybe when I worked for my dad, when I worked in Brooklyn, or even here, like people reaching out asking if we do specific techniques. And I understand that you can have a lot of benefit from a specific technique. However, most of the time, there's not a whole lot to it that specifies it that's making it better than something else. So like if you've heard of ART, which is active release technique, that is not rocket science. It is a type of soft tissue manipulation that literally anybody can do if they understand the concept of what's called pin and stretch. It's really, and they understand how muscles move. It's not like, I'm going to piss off if anybody.
You're gonna get a whole bunch of ART bros coming at you. I
don't care. I don't really care because I actually have been certified in ART because a previous boss I had wanted me to be certified because that was something that he felt was important to promote in the practice.
It's definitely a marketing technique.
100%. That's what I'm trying to say. It's a marketing technique. So you could be interested in dry needling. You could be interested in ART. You could be interested in cupping. But really, the provider, if they have multiple tools in their pocket in order to get you the outcome, that's the thing that should matter. And beyond that, if the person that you're seeing isn't doing active rehab, then I would recommend finding somebody who does. You could, by all means, you could see one person for all the passive care and another person who focuses more on rehab. But I'll be completely honest, it's like the rehab is really the glue that makes everything stick together and makes the biggest change for long term.
One thing that we'll always say is, I know you said that the joints act and the muscles react, but there's so much neurological input at the joint level.
Yeah.
The joint is truly the brain of the movement.
Yeah. It's the professor and everything else is the student. And so the way that I used to talk about it is like the joint itself, if the professor that you have is a fucking idiot, then all of its students are going to learn piss poor information. So the smarter the joint, the smarter the tissues. I say this every episode. I was going to say something and I forgot.
It's okay. Maybe you need to do what I do and have a notebook in front of you so that you can write it down. Not today, not yet.
I need a fidget toy again. I broke mine. I fidgeted too hard.
Does sound like you.
Oh boy.
Well, we were talking about how the joint is the brain.
I remember what I was going to say.
Good.
So
I was just stalling anyway.
Passive care definitely has a role in even the psychology of where you're at. So let's say something really hurts. Let's say your shoulder really hurts. If your provider never touches it, it's honestly, even just giving that attention to the area can be, I don't want to consider it a placebo effect, but it can create a pain-free sense because your brain is like, oh, it's been worked on.
You're saying just physically touching the area?
Yeah.
Oh yeah. I mean, there are neurotransmitters and happy chemicals that get released from human contact.
Yeah.
So yeah, definitely.
And then beyond that, like I said before, it's like passive care has a time and a place for helping decrease pain so that you have more movement options with pain-free range of motion. This is what I say about pain management, like when you get injections and things like that. It can be a great tool as long as you leverage that pain-free time by retraining your body how to move in that pain-free time frame.
Yeah, we always look at that as opening a window so
exactly.
that you can get into the good stuff.
Yes. But too many people just get the passive care and then they are like, why aren't I getting better?
Yeah, I think that comes down to just a bigger problem in the society where, right, we want to have things
easy.
We want to have things easy, and passive care typically is definitely from a client patient standpoint. Yeah, it's definitely an easier thing to go about. But again, sometimes it's completely necessary for you to go through that before you can get into the other stuff. And we talk about your ankle injury a lot, but right, like there was a point where you couldn't do a whole lot. there needed to be things done to the ankle to help it get to where it needed to be so that you could start training it again.
Yes, exactly. Like it opened up range of motion passively so that I had more range available to me to practice getting more active range. So 100%. I think that there's a lot of providers on Instagram that they like talk shit about any passive care. And it's like, the fuck are you talking about?
Yeah, you need it. Any extreme is wrong.
They're like, soft tissue's bullshit, all this stuff. It's like, it's not though. It provides so much, whether it's mental or physical, it's providing a service that helps that person. So I think if you come across people who are shitting on any amount of passive care, then they don't really know what the fuck they're talking about. I would question their results clinically. I don't know. I would question how their bedside manner, honestly. But, yeah, and then like, let's say you're active, like this person, the guy who had low back pain and he likes to lift, but now he's just not lifting and he's avoiding all movement. That is going to decondition you, firstly. And secondly, just focusing on stretching is not going to teach your joints or your tissues how to improve under load. There's no change in your body's capacity. If actually there is a change, it's worsening. Yeah, you will have a decrease in capacity if you completely stop everything and just focus on passive care. Your body requires load in order to re-enter loaded activity.
Yeah, and I said to him, when he mentioned that, I said, I understand your thought process. Yeah. It makes sense that you're like, okay, I think this is what caused the pain in the first place, so I'm going to cut back on it. In theory, totally makes sense.
Yeah.
But yeah, to your point, when it comes to, if it is truly a joint mechanical issue, he's not doing himself a service by taking that away.
No. I feel like I've yelled a lot today about this stuff.
Yeah, you have. You have.
Is there anything else that we should touch on about it?
Well, I think I don't think. I know this. I really like what you mentioned about how just shitting on passive work is not the right solution for people. I think, and the opposite too, right? Like if you see somebody and they don't think that you need to be doing active things, then that's part of the problem.
Just reminded me of what I posted the other day. Like I spoke to this potential new patient and she told me, because she had a disc injury, she told me that her current chiropractor told her that she should just foam roll for the rest of her life and then she'll be perfectly fine. Like she doesn't need to do any exercise.
What the hell? That's crazy. Because right, foam rolling is passive.
It's passive, and honestly, I think foam rolling is maybe one of the most useless passive ones. But there are arguments that it's not, like that it has use. But
like we were saying before, it's not necessarily human contact, but you're getting contact into the area. Yeah. Therefore, you're most likely increasing blood flow. For sure. Yes. There's probably some level of, you're getting some fascial movement. There's probably some lymphatic movement that takes place in the area as a result of it as well. So it's not something that is totally useless, but again, not going to solve all the problems that you have.
I just want to say this because I would imagine that a lot of our audience is educated on like they've heard about fascia. And I think fascia is overly focused on in certain places.
Well, it's like a cool fucking word, so people are going to say it over and over and over again.
There's also part of why I won't even discuss fascia in foam rolling is because just smashing fascia does not change it. Like the reason why when fascia is functioning, it's gliding over the muscle layer, right?
Yeah.
It's not adhering to it. So it's like, even from that, I'm going to argue I just think foam rolling is a bit of a waste of time. Don't shit on anything, but I'm going to shit on foam rolling.
I mean, I'm gonna say, I sometimes when my shit is feeling fucked up,
you'll foam. Yeah,
I'm gonna foam roll it, and I'll feel better afterwards.
Do you just foam roll, or do you move on the foam roller, like you pin something and then stretch something, or are you just rolling up and down on it?
Honestly, I probably do a combination of both of those things, and then I do active stuff afterwards.
Right. Okay. So yes, always following it up with the active stuff. foam rolling, I think like there's better uses for it. So this is what I'll say. I think when I think of foam rolling, I think of somebody just rolling up and down on a roller on tissue. And to Vinny's point, yes, I think it brings blood flow to the area, but I think it kind of stops there. I think that you could make it more effective by using it as like a pin and stretch type thing like ART, where you smash an area and then actively move your joint to get that tissue to lengthen and shorten underneath that pressure. But anyway, I forgot how we ended up here.
Yeah, I don't know how we ended up here. That's what happens when you have a conversation, though. It usually goes somewhere on its own.
Yeah, and
this might have froze.
I think...
oh, it's still recording.
Yeah, I was going to say, I think the app says that it's fine if it freezes. So if you're watching us on YouTube, maybe it didn't freeze. Maybe it did. I don't know.
Tell us.
Let us know. Yeah, so bottom line is we're active beings. We're not passive puppets. So if you have something that hurts when you are active, you have to treat it with active care. And that is not laying somewhere and having somebody do something to you. And it's also not just passively stretching. It is active. Right?
Yeah.
The end. Now, really the end.
Okay. Really the end.
It doesn't have to be if you have something else to add.
I have nothing to add.
Okay. All right. Well, as usual, please subscribe, like, share. I'm even going to add review us. We've given a few episodes so far. I think maybe by now you could review us and tell us that you love us or you hate us. And either one, we're happy if you love us. And if you hate us, I don't really care.
Yeah, don't just hate us. Like, give us suggestions.
Yeah, if you hate us, tell us why.
Yeah, exactly.
And make it constructive. If it's just like, I hate your voice, then I can't change that. I understand my voice isn't for everybody.
I mean, I could change my voice, but...
so much effort.
Yeah, it's a lot of effort.
Yeah, so like, subscribe, review, share.
Yeah, I would even say, this is actually a question that I have for the audience.
Oh, okay.
Do you like it that we give like updates about our life at the beginning of the podcast, or would you like to hear that at the end of the podcast after we've kind of gotten into some of the meat of the conversation?
Interesting.
Yeah.
All right.
Yeah.
Why do you care?
Just because I'm curious if there are people who are like, I don't fucking care about your life.
They can fast forward.
Still, I want to know.
All right. I just want to know if you have any takeaways other than maybe you have the takeaways that you love when we bullshit at the beginning or that you hate it.
Yeah, that's what I said.
I know. I'm just going further with what you're saying. All right. Well, I feel like every time I say I love you. Love you. Bye.
Bye.
We will see you and talk to you next week. Okay. Love you. Bye.